So this is a questionnaire that was newly developed to look at fear avoidance behavior. Fear avoidant behavior, obviously very prevalent in concussion. People are afraid to use their cognition. They're afraid to do physical activity because they think it's going to make them worse. But this is a great quote here that I will kind of just read off. Fear avoidance is a coping style characterized by the avoidance of activities or situations that are perceived to provoke or worsen symptoms due to fear of the symptoms and their associated consequences. It is well established that fear avoidance contributes to the development of chronic pain following musculoskeletal injury. Following injury, persistent avoidance of activities perceived to worsen pain leads to muscle disuse, which perpetuates pain and reinforces avoidance behavior. This maladaptive coping style is a robust risk factor for disability in patients with chronic pain, but importantly, is modifiable with targeted psychological treatment. The fear avoidance model has been applied to a variety of other chronic health conditions, such as chronic fatigue and fibromyalgia. There's also a large body of evidence to suggest that fear of falling in older adults leads to limiting behavior and poor quality of life. Fear avoidance behavior also appears relevant for symptom chronicity after MTBI, following concussion. Sensory stimuli like loud noise and bright lights, and physical or mental exertion tend to bring on or worsen post-concussion symptoms. Activity-related symptom exacerbations can be aversive and distressing, thus reinforcing avoidant behavior. Over time, excessive avoidance of activities or situations that provoke symptoms may sensitize individuals to these triggers, such that when symptom triggers are encountered, symptoms become more easily provoked. So it actually makes them worse over time. They think it's protecting them, it's actually making them worse.